everyone, welcome back to your friendly neighborhood atheist. And I'm sorry, there's two things you're going to notice immediately. One, I am not in the studio, so I may have some echo on my audio, which I apologize for. And two, my headset broke, so I have to buy a new one. It's not like sticking to my ears like it should. So I'd like to apologize for that in advance. But regardless, even though the quality isn't where I wanted it to be, I still want to keep going with these podcasts. And I've been very excited. Dr. Ben and I have talked about this for the past 6 months. I really want to do the stream. So, Dr. Ben, how the hell are you?
Doing all right. I moved across the country recently. I'm kind of in a gap year between intern year and then switching specialties. So it's just been a lot of limbo. But okay. I'm doing all right. Like I'm still working. But just in a primary care capacity, basically. So it's a bit of a waiting game at the moment while I wait to reapply. So
what is in terms of being a doctor, what is your area of specialty?
Well, so that's the thing. So I was in family medicine. I was in residency to essentially be the Swiss Army knife of medicine, where they do pretty much everything except surgery. And I didn't like how broad it was. And so I'm actually changing gears. So I'm going to be reapplying for internal medicine, and then, which is essentially just adult medicine. And then from there, you can subspecialize. So I plan on specializing in nephrology, so specifically kidneys.
Did you say nephrology?
Nephrology, yep.
Nephrology, okay. So you focus primarily on the kidneys is what you're saying?
Yeah, I would. And so that's years down the road.
Okay.
So, yeah.
Okay, so before we dive into this topic, my initial question is, what do you think makes you qualified to talk about trans issues?
Yeah, so I'm trans. I'm a trans guy. Started socially transitioning in my, just after my first year of med school, or kind of near the end of my first year of med school. Have been on hormones for just over 3 years. And especially with my experience in family medicine, have provided gender affirming care for primarily for adults. I did take care of kids, but in terms of providing the medical side of gender affirming care, that's more specialized to adolescent medicine or pediatrics. So I've been kind of involved in that, but I wasn't really doing the care myself, more in teamwork with other people. So I have done this care before. I know the process. I know the medical system very well. And I know a lot of the studies that are being talked about and kind of the legitimacy of all of those. So I think that makes me kind of an okay person to talk about this issue.
So when you describe gender affirming care, what do you mean by that?
Yeah. So a lot of people, when they think about this, want to associate it with surgery or hormone therapy. And yes, those are parts of it, but really it's anything that supports a person's gender identity. And so when we think about gender, there are several terms that go around. And gender is kind of this overarching broad umbrella that can include your gender identity and how you express your gender and how you interact with society as that gender. So, for example, a man, a cisgender man, but I'll say a man for now to keep it simple, a person who identifies as a man, they know in their brain, they know in their heart. If you're talking to a kid, I often explain it as do you know what you are in your heart? Are you a boy or a girl? A lot of times they'll say I'm a boy, I'm a girl. Of course, there's a lot of in between, which we'll get to. But if someone says I'm a boy or I'm a man, that is their gender identity. And then how they interact with society is their gender, quote unquote. So a man might be addressed as he or sir, or they might use the men's bathroom, or they might wear a certain set of clothes that tells people, hey, I am a man. There's a lot of subconscious things that go on when we interact with other people. And we don't really think about it all the time. What we're doing, you reflexively respond to somebody by how they present to you, and then you respond according to your culture. So in our society, there are certain clothing styles that are feminine, and oftentimes, if you're wearing them, people will assume that you're a woman. If,
Right.
there's some nuance with that, but a lot of times these things relate together. So, like your clothes, your hair, all of that is your gender expression. So, it's how you communicate your gender to society so that they interact with you in the way that you want to be interacted with.
Okay.
Makes sense.
Uh, so yeah, absolutely. Before we get into the more complicated questions, can
Mhm.
you, in a brief tidbit, explain what it means to be trans?
Yeah. So, like we were saying, this whole kind of gender triad, if you will, someone who is cisgender, basically all that means is they're not trans, is someone whose body in their chromosomes, what we define as their sex, which I'm sure we'll get into in a moment, but their sex that they were assigned. So when you're born, oftentimes a doctor said, "Hey, that's a boy, that's a girl," and then you're raised that way. um, Oftentimes that aligns with how the person feels in their brain or in their heart, as we would say to kids. But how you identify usually aligns with what your body looks like and with what your body does.
Okay.
So that would be someone who is cisgender, but someone who's trans, their body and their biology essentially does not line up with their identity. So they have this mismatch of how they want to be perceived by society, um, and society does not reciprocate that because they don't display a lot of the characteristics that would reflexively cause someone to reflexively say that's a man or a woman.
Okay. So correct me if I'm wrong. The old tradition, it is said that we're either XX or XY. Is the
Mhm.
first part of that statement correct? That's
It's
how people
partially.
viewed it usually.
Oh,
That's
it's how
how.
people yeah, that's how
Okay.
people typically viewed it, and currently many people still view it that way.
Okay. But the correct is it could be XXY or XXY. Is that accurate as well?
It could be any number of sex chromosomes. So really the only one that's not really viable it would be YY. We don't really ever see like people that live who are YY, but there can be any combination of XY, even X with no other chromosome. That's Turner syndrome. You can also have XYY, XXY, you can have XXXXXY, you can have a number of combinations, and that just depends on how the cells in meiosis divide. So if there's a point where they get stuck together, or if too many copies were produced, then you can end up with more copies. But generally, as long as there's one X chromosome present, then it will be a viable pregnancy and a viable uh, delivery with a viable fetus. So
Now, is that something that can be tested, or is there even a point in testing it where someone has like XXY or XYY?
usually it's not tested for. Usually, most people who are intersex, as we would say, don't usually know unless they get fertility testing. That's the most common place that people are diagnosed. Is because people primarily like the common ones we'd see XXY is probably the most common. Also X with no other chromosome. That's also very common. Um, there are some things that you could tell a bit earlier in life. For example, with Turner syndrome, you can have issues with the aorta. You can have other issues that
Sorry,
affect
can you
their
explain
well-being.
when you say there's an issue
Yeah.
with aorta, what are you referring to?
Yeah, it's called coarctation of the aorta. So it's too narrow at a point. And if it's too narrow, you can't get blood to your feet. And so that's a real medical concern, or really a surgical concern, that would be a reason to test for this. Um, because there could be any other abnormalities that do cause harm if the person lives with that. However, a lot of people who are XXY don't know. And many of the other combinations people don't know until they grow up and then they're trying to get their partner pregnant and they can't. And then why does that happen? And that leads into a whole evaluation of like, is it the sperm? Is it like, are they producing enough? Are they just like not functioning well? All of that. And so that whole thing leads to karyotyping. And then they'd find out, oh, actually, I'm XXY, or I have multiple different sets of sex chromosomes. So most people that have these conditions don't even know. So a lot of the data is probably underestimated because we don't, like, if someone doesn't find out, then we don't have that data to work into our percentages. We don't know what the actual prevalence is in society.
Okay. So one more kind of basic question. Can you define the difference between sex and gender? Because I was raised that they were the same thing, that there's no difference. And I've seen a lot of conservative Republican arguments where they say, well, if you look at a doctor's form, it says, are you male or female? So there's no other choices. What are your thoughts on that? And how do you define the difference?
Right. So if sex are biological characteristics, and gender is more of your psychological or sociological categories, that's kind of how I would divide those. But as far as the biological side, you can't pin sex to any one single characteristic because there are multiple factors that all play in. And if one of those factors is out of alignment, then you can end up with a variety of different combinations. So I would define sex as the combination of sexual characteristics that a person has. And it's a multifactorial equation, essentially, that will give a bimodal spectrum of results. So what a lot of people will say is, and I'll just kind of simulate a conversation that I have with so many people about this. So they'll say that sex is your anatomy. And then, so that leads to the question, which anatomy makes you male or female? Because there's multiple sets of anatomy. There's external genitalia, which are different than your internal genitalia, because they develop differently on different pathways. There's also testosterone testosterone analogs essentially produced by the adrenal gland. So you have other organs involved in this that can play in. You have with your chromosomes, that's the next thing that people go to is if your anatomy doesn't line up, then, oh, well, it's their chromosomes. Well, as we mentioned, chromosomes don't always give us a nice, clear answer. And there are genes on the Y chromosome that can move over to the X chromosome. So you can be XX and have a full, completely functional set of male genitalia because you had the gene that was on the Y chromosome that moved over. So, and there are much more genes. So that's the SRY gene is the one that people really focus on, but there are many, many more genes, and a lot of them aren't even on those sex chromosomes. We're still uncovering what all plays into this equation. And kind of the big thing is that the result you're going to get is largely related to hormone activity. And because the genes, the chromosomes, all of that, it pushes forward a pathway to produce hormones, and those hormones bring forth the rest of the characteristics because all of the genitalia, that is hormone driven. Okay. Like hair patterns is all hormone driven. Kind of the one thing that isn't dependent on hormones is gametes, which people will talk about. But
did you say gametes?
Gametes. So ova and sperm. However, the gonads, the testes and ovaries, are hormone driven. So you get this whole cycle starting from what is on your genes. However, as I mentioned, many different components that play into this, you can have somewhere in between. For example, all of the external genitalia is on a spectrum. Okay. And they're the same structures that just develop slightly differently based on hormone input or lack of hormone input. And a lot of it is testosterone. So it's either testosterone or not. And so we actually see conditions where children will be born and they will be assigned female. They will have a visibly obvious set of external female genitalia. And then they grow up. And once they hit puberty, they develop male external genitalia because
Really?
because they had an absence of testosterone reactivity. So they had testosterone present, but the receptors wouldn't respond.
Okay.
And so what happens is the external male genitalia is responsive to DHT primarily, which is like a stronger testosterone.
Doesn't DHT also cause hair loss?
Yes, which is why finasteride is used to reverse male pattern baldness. So because you're actually blocking that pathway. Yeah.
Okay.
Yeah. So that's the reason for that. But both the internal and external genitalia develop from different hormone influences. So you can develop like completely female because you had lack of testosterone. But then once your DHT kicks in around puberty, you get a lot more of that. Then you start developing kind of as you would have, because now you're able to respond to testosterone. So it's a bit more nuanced than that for how much reactivity you're going to get depending on the receptors. But you can have so many different conditions like this. There are other examples with congenital adrenal hyperplasia, which is in like babies that are assigned female who often have XX chromosomes. But if they have a condition where they end up producing too much androgen or too much male hormone, they end up getting ambiguous genitalia because they're essentially under the influence of testosterone in utero, which is what drives production of male organs.
Okay.
So,
yeah. Oh, sorry. Go continue, please.
Oh no, but so I know it gets really messy talking about sex, but if you think about that pathway, all of them work together. So you can't really say you're a man because of a penis. Well, then you're going to have to answer for the men who are like people who are XY and would be assigned female because they don't have that development.
Okay.
They don't always align, and you can't pin it down to just one thing because there could be any number of combinations.
Okay. So let's say this, and this may be an ignorant question, and I apologize, but you said you're trans. So if you go to a doctor, do you say, hey, I was born a biological female, but I identify as a man? Like, how does that work in a doctor's office?
Yeah, it's really not that much words you need to say. You can, because usually at the beginning of your transition, unless you've already changed your gender markers by that point, like you're going to be in the system as your biological sex. Or if you show up, oftentimes there's a space for sex and gender now. Now a lot of offices will have it separated. But you can always say, like, if it's not on the form and you want to be open with your healthcare provider, then you can say, my sex is this, I identify as this, or you can say, I'm a trans man, I'm a trans woman. But oftentimes if they don't have those things, I'm not super inclined to come out to them. Usually I'd find somebody else. But if you needed to, then that would probably be the easiest way to do it.
Okay. So I got submitted a bunch of questions, but I want to wait on those until we get into a few more things. So at what age, I'm trying to think of the best way to ask this question, but at what age can someone realize they're trans and start using some type of hormone therapy or testosterone therapy?
Okay. So I'll kind of walk through the process of like realizing your gender and kind of undergoing the process for different age groups, because it's very important to distinguish them. So most people have some kind of inkling that they're not the right gender, like not the right gender. I'm saying that to simplify it. But it's a bit more complicated than that. But if you were assigned the gender that you don't identify as, oftentimes you'll know early on in childhood. A lot of people will know around age 2, 3, 4. That's kind of when you're solidifying your gender identity, but your sense of self develops throughout your entire life. Like that's not something that's static for really anybody. You're like most people can look back at pictures of yourself from like middle school, high school, and say, oh, who even was that kid? I would not do anything like that now, but because you're constantly changing. Yourself and your sense of self constantly evolves. And so that's something to take into account. But even despite that, trans people have a persistent sense of self that differs from how society treats them. And so if for a lot of people, even if they don't have the words to put to it, like that was in my case, I didn't even know being trans was a thing until much later. But you'll have kids that will even say, I want to be a girl, or I'm a girl. And they just know for themselves that is who they are. And it puts a disconnect in how they interact with the world. But not everybody starts gender affirming care at that point. Of course, a lot of people have things kind of delayed into adolescence and adulthood because, I mean, when we were kids, it wasn't really talked about. People didn't really know it was even a thing. So for people that are coming to it in adulthood, it's a lot easier to start that process and get things going because you're an adult. You can make your own decisions. You know yourself. It's like the same thing. You can walk into a tattoo parlor and get a tattoo. Like you're allowed to do that. It's going to change your body forever. Yeah. That's your choice. You're an adult. You can do it.
For the record, I regret all my tattoos.
Yeah.
Like I want to get them all removed.
But you were allowed to do it, and everyone else should be allowed to do things to their body,
Right.
like especially as adults. So for an adult, if you're in a state that is fairly supportive, regardless, you're still probably going to start socially transitioning first. So that means like changing your hairstyle, changing the way you dress, maybe trying different names for yourself. Trying different pronouns, all that stuff is social transition. So it's stuff that isn't permanent at all. And that's the same at all stages of development, at all stages of transition. So no matter what age you are, you can socially transition. And that really shouldn't be a big deal because that's just you acting like yourself, trying out different things that you can always undo later. You can always undo a hair change. You can undo a name change. You can undo all those things. You can explore, learn for yourself. So that's kind of step one. And I recommend, and the guidelines also recommend going through some counseling or some therapy during that time as well. Not because it's a mental illness. And I know we'll get into like
that's
those
another
comments
question
later.
I wanted to ask.
But you go into it because number one, I think everybody should have therapy. Therapy is amazing. But you're going through a life change and you're going through an adjustment and finding out who you are as a person. And it's helpful to have somebody go along with you and help you explore that in a way that's safe and productive. And so I think everybody, should be going through therapy. But that's the first step is social transition and therapy.
Okay.
And then for an adult, you can go to your doctor as long as you go to one that provides the service, and you can ask for hormone therapy. You can say, hey, I'm trans, I want to start this. And they have like a small job of just letting you know what the risks and benefits are, letting you know kind of what to expect from the medical side of transition. And then after kind of talking you through it and making sure that you are in a state of health that is appropriate to undergo this type of medical care, then you can just do it. It's an informed consent model for adults for the most part. And just like anything else, like plastic surgery is an informed consent model. Like you're told the risks and benefits, and if you want it, you get to have it because you consent. For kids, it's not at all like that. So completely different process. And I think that a lot of the confusion comes from people thinking that the informed consent model applies to minors, and it doesn't. And it's very, very sticky. So bear with me a little bit for this.
Yes, please.
But for transition, it all depends on their stage of development. For a super, super young kid, like the only thing you're going to get is social transition and therapy. That's it. Because there's nothing you can do, for one. And they're too young to start any of the other medications. So there are age cutoffs or development cutoffs for the actual medical therapy. So for hormone therapy, we really don't start that until kind of mid to like maybe like early, I can't say early adolescence, like maybe 12, 13 at the absolute minimum, like depending on how you're developing, but usually you're seeing that 14, 15 and up, because that's meant to simulate the development of the opposite sex, right? So the goal is to help you develop at a similar age appropriate rate to your peers.
Okay.
And so that's where puberty blockers come in, and it's not what a lot of people think it is. And the word, in fact, the puberty blocker word is kind of a misnomer because it's not blocking puberty, it's just pausing it. And so you cannot start it before puberty. So there's no way to get any medical, like gender affirming care before puberty because it just nothing happens. You cannot block a puberty that is not happening. So you have to have started puberty in order to get those. And all it does is it puts a pause on your normal puberty development while you go to therapy and while you socially transition and figure out for yourself who you are. You can stop that. Normally, the time frame they give people, according to the guidelines, which are a bit more conservative than what the actual safety of the medication is, but the current guidelines are that 2 years is kind of like the most you'd want to be on that by itself. But most people, they're on it for a few months to a year to kind of figure out who they are and if they want to undergo hormone therapy, because like the puberty pause is reversible. HRT is not.
Okay, can you explain the differences between those?
Yes. So it might help if I got a little picture. So we're going to go right into how puberty blockade works. And I have a little diagram just so it kind of makes sense.
All right, let me put that. I'm still listening. I'm just going to grab my water real quick. So please,
no problem.
Feel free to continue talking.
So here's my little lecture for everybody. So we have here the hypothalamic pituitary gonadal axis, which you see the brain up here. We're primarily pointing to this little blue part. I don't know if you all could see it super well. But this is the hypothalamus. It's a very tiny blue circle at the bottom of the brain. You also have the pituitary gland. We're primarily focusing on the anterior side or the front side. And then you have the gonads, which are the testes and the ovaries. So when you are hitting puberty, or this is primarily when this is going to be the most active, you have the hypothalamus that's going to produce GnRH, which is a hormone that then goes to the pituitary gland and says, hey, it's time to produce sex hormones. And the pituitary is like, yeah, let's do that. So it then produces LH and FSH, which then travel down to the ovaries or the testes, whichever ones you have, and tells it to produce. If you have testes, it's going to tell them to produce testosterone. And if you have ovaries, it's going to tell them to produce estradiol or estrogen and progesterone. And then it will keep producing those until you have enough that builds up in your bloodstream that then tells the hypothalamus and the pituitary, hey, it's time to stop. We don't need any more. You can slow down. This whole process ramps up a lot getting into puberty because it's the time to produce all your sex hormones. So what puberty blockade is doing is it's actually increasing this pathway. So it's enhancing the pathway that you already have. In that it is a GnRH agonist. So it is adding on to this process. So it simulates GnRH. And so what you get initially, you get an increase of your sex hormones because you have the hormone that's telling it all to ramp up. But then in the fact that you're causing it to ramp up, you're telling it also to turn off. Okay. So you get so much of it that we call it negative feedback. So it's telling the whole process to stop, pause. And so that's what you're doing with this. When you remove that, everything, it can take a little bit of time for it to build back up to what it normally does, like its normal rate. But you take that off and it just goes back to the normal cycle. What you've just done is taken off the inhibitor. You've taken off the thing that was telling it to slow down. So what's important here is that the testosterone and estrogen and progesterone cause irreversible development. So puberty is an irreversible process. Okay. So what we can do with pausing it is allow you enough time to make the decision of whether or not you want to do your own puberty. And then if it's, I don't think I'm trans, I'm going to step back and do my own puberty. Cool. We'll take you off the blockers and you go about your business. And then if you want to go on hormones, that's when you have to very carefully balance these, because oftentimes you'll stay on a little bit of the blocker while you increase the hormones up to the correct level for that age group. So especially one reason to do this would be in people who are undergoing a masculinizing transition, where you can't give them enough testosterone that early in order to suppress their menses. So in order to stop their periods, you can't stop their periods you need a lot of testosterone to stop periods. Okay. So some options for that case are either to continue a little bit of the Lupron or the puberty blocker and kind of ramp up the testosterone along with it, or you put them on a birth control to control the bleeding and then while you're increasing the testosterone. So it's a bit of like push and pull with that kind of thing. Okay. But it's safe when used within the confines that we have. The puberty blockade is actually really, really safe. And we've been doing it for children with precocious puberty for a long time. So there have been kids that go through puberty at age 6 or 7. And this is what
really you can have puberty at that young of an age?
Yeah.
Oh, wow. I didn't know that.
Yeah. And so that's why we would use this kind of medication. That's one of the reasons why it's like already approved for that age group, is because like people have concern about using puberty blockers for 9, 10, 11-year-olds. We're already using it for 6 and 7-year-olds. And so the side effect profile is pretty similar to what we would get with those age groups. So,
okay. So at what point what do you think is an acceptable age when physical gender affirming care is acceptable? And what I mean by that is transitioning body parts.
Yeah, you're still talking about surgery, essentially.
Surgery, yes.
Yeah. So genital surgeries are not done on minors. Like if they are, it is very, very, very rare exceptions, but it is not in the guidelines. It is not approved. Wait for him to put his headphones back on.
Sorry, I sneezed really hard. My headphones came off.
No, but genital surgeries are not approved for minors. They're not part of the guidelines. So the arguments that suggest that minors are getting genital surgery,
it's bullshit.
That's not something to make part of the argument. Yeah, it's not part of guidelines. Again, I can't guarantee that there's never been one done, but that would have to be like the very, 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 very rare case, and usually for some other reason, for some other likely medical reason or some other unfortunately traumatic reason. And that would be a totally different set of ethics that we'd go by for that. Interestingly, though, a lot of like states are still allowing for genital surgeries to be done on infants who have ambiguous genitalia. So it's
What do you
still
mean by
like, so people who are intersex,
Okay.
it's still, there's still places that will forcibly do surgeries on babies to make them more like what we would expect.
Correct me if I'm wrong, but don't they, and I could be, to the audience, I could be very wrong. That's why I'm asking. Is it true that if a baby is born with both male genitalia and female genitalia, that they'll go up to the parents and ask what gender they want them to be and then go with the appropriate surgery? Or is that bad
That's,
information?
well, it's still allowed in some state. It's state regulated. So, so yeah, that still is a practice that's done, and that's something that I do not support. That's something that the broad medical community in general does not really support, because we're getting into issues of consent, and that baby did not get a say in that decision. So it's interesting when people bring up that older children cannot make decisions about their own healthcare, which we'll get into that issue probably later on too. But a lot of them still support non-consensual surgeries for babies to look more normal. So yeah, so as far as transgender surgeries, genital surgeries are not done on minors. These surgeries, when you hear people mention trans surgeries like being done on minors, they're
Right.
talking about top surgery, which
Okay.
is a totally different issue, because number one, we allow top surgery on cisgender children. So adolescents, especially who have breast tissue that exceeds their ability to safely move around and walk, etc., you can get some pretty severe back problems if you have excess breast tissue. And so people can get breast reductions. That's allowed to happen on minors. In fact, about 1/3 of cisgender boys have gynecomastia, just like for no reason. We don't know why.
What is that?
Breast growth. They have,
Oh,
yeah. So like, and it's likely related to estrogen production in their puberty, because testosterone is actually converted to estrogen. So if you have high levels of testosterone, and it kind of lingers around, it will be converted to estrogen, and you can get female characteristics, which is why a lot of people who do steroids will end up with some female characteristics like breast growth. So, but you have about 1/3 of like young boys who develop breasts in their puberty, and it's allowed to do the same top surgery that you would do on a trans guy, on a cis guy. It's the same procedure, but for some reason, a lot of people don't have a problem with it being done on a cis boy, but they do on a trans boy. But
So,
those are allowed.
and if I remember you saying this, please correct me if I'm wrong. Top
Mm.
surgeries can be done as early as 16. Is that correct?
That's the youngest that I've, at least for transgender top surgery, that's the youngest I've really heard of it. I think there might have been somebody at 15 that's had that done. But again, we're seeing trans people having it done at a later point than cis people could have it done sooner. Like a cis boy with gynecomastia could have that done sooner than a trans person.
Okay. So this, this is one of the objections I've heard from conservative friends. Our brains, from my understanding, aren't fully developed to 24, 25. So do you think it's okay for someone as young as 16 to have a top surgery when their brain hasn't fully developed?
Right. So this is where we get into consent. And this is surprisingly very, very, very sticky, or should I say unsurprisingly. So it is not a blanket. You cannot consent if you're a minor. That doesn't leave room for nuance. There's a lot of nuance in these discussions.
Okay.
And it depends on where you live, on whether or not you have the right to medical consent for yourself. There are places like the UK that have a pretty standardized like system of how to judge clinically whether or not somebody is capable of consenting to their own medical procedures. And so they have a whole procedure there of if they meet these certain criteria, they can make their own decision. The US doesn't have that same system, but the data is out there to suggest, number one, that like that of course kids develop at different rates, and certain people would be like more mature and able to consent at different ages, as far as understanding the decision they're making, and being able to make the right decision for themselves. Nonetheless, when you're talking about trans related procedures, it's not ever the kid's consent. It's not ever the minor's consent. It's the parent's consent. The discussion is between the patient, the parents, and whoever's providing the medical care. So when people think that it's a young person just going out and making whatever decision they want, that's not at all happening, because they have to have so many criteria that are met before they can even begin that process. So they require a very thorough psychiatric evaluation to make sure that they're able to do that. They have to have a full team of practitioners, including that mental health care team, their primary care team, endocrinology team. They're all like different teams. And again, like I said, the hormone side is not done by primary care for minors. That's done by a subspecialist. So that is somebody that is qualified in managing hormones for minors. So you have them, you have the parents, and you have the patient on board. And so this whole team, and if you've got surgeons, you got surgeons on board, and everyone's working together to determine if the steps being taken are the right ones to go down. And so ultimately it is the parent's consent. However, there are a lot of cases that we can look at in medicine to say, should the minor have a say in their own healthcare? And most of the time, the answer is yes. For example, I'm gonna give you some things to think about. Pregnancy. Pregnancy is something that will often, in a lot of states, will emancipate minors. Or at the very least will allow them to make decisions for their own baby, which is wild. So you could be a minor if you're a 16-year-old and you get pregnant and you have a baby. In some states, you do not have the ability to consent for your own medical care, but you do have the ability to consent for your baby. So that's kind of wild to me, that you can't, like, you're somehow responsible for somebody else, but can't be responsible for yourself.
Right.
But also, you look at things where you have like 16 is not the youngest age that people can get pregnant. You have 9-year-olds who can get pregnant. You have anybody that has hit enough puberty to get pregnant. Unfortunately, they've gotten pregnant, and a lot of states are requiring those kids to carry pregnancies to term because they won't allow for termination. So,
which is so fucked up, man. It's
so can a kid at age 9 consent to a full-term pregnancy and all of the risks with that? If you think no, then you need to reconsider your stance on their ability to weigh in on this conversation. But think about other things like blood transfusions. If you have a child who is the kid of a Jehovah's Witness family.
I was just gonna say Jehovah's Witness, because
it's like if you have a kid,
blood transfusions.
Yeah, and so think about this: if you have a kid that needs a blood transfusion to stay alive, and the parents will absolutely refuse, do you think we should take into account whether or not the child wants it? Do you think we should just let the kid die because, well, their parents are the ones that have to consent? That's where it gets very ethically sticky of where do these boundaries lie? And that's where a lot of the political debate comes in, which it's kind of unfortunate that it ends up being a political discussion when people don't understand that these conversations are actually happening, and we have to make decisions based on these conversations. It's not like to have to sit in front of a child and say, no, well, no, sorry, your parents want something for you. No, that doesn't happen. We don't just automatically go with what the parent says just
Right.
because the parents say. There are times that we call CPS. There are times that we do the medical standard of care because what the parents want isn't appropriate. Other example, like a more minor example. Let's say you have a minor who is from an anti-vax family, and if the parent said, no, I absolutely don't want my kid to get the vaccine, and the kid says, actually, I do want to get the vaccine, that's an ethical dilemma right there.
Right.
Because the kid can't consent. The parents have full ability to consent. I don't know what a lot of people here like would say on who gets to make that call. My perspective on that. Yeah, my perspective on that is like the physician, and in this case the pediatrician's responsibility is to advocate for the patient who cannot advocate for themselves. And so their job is to tell the parents like, hey, this is the medical recommendation. You are advising something that is against medical recommendations. Your child is on board and wants to get vaccinated. Like, can we do this? Like, my job would be to help persuade the parents that like, hey, this kid has something that is reasonable that they want.
Right.
And we should respect that. It's the same thing with trans care. So people like to think of it as this new thing that people don't know what they're doing. Like I said, a lot of minors know that what their gender is when they're toddlers, the same age that a lot of cis people do. The difference here, though, too, that we have to consider is that this isn't, when we're doing this for minors, this is not purely a cosmetic thing, right? So not every kid is going to have access to medical or surgical transgender gender affirming care, right? Like
Right.
I just described a whole process that you have to go through to even have those things available. So the minors that are getting these are super, super high risk. Oftentimes, like these are kids that are bullied, they're harassed, like they have violent encounters with people. They have, like, I've had encounters with minors in a mental health facility who was trans, and it was a teenager, hadn't had access to any medical transition, and had to be completely isolated from everybody else because they just kept getting bullied by everybody else.
Oh,
The reasons that make kids high risk like this is often not just being trans. It is what society does to them because they're trans. A lot of people who don't have those barriers, and a lot of people that don't have those really, really tough social situations, oftentimes they can wait until they're later before they transition. And oftentimes a lot of them do, because a lot of them don't experience enough distress to kind of meet those criteria. So we're already talking about a very high risk set of minors. And so if you have that situation now where this is a life-saving measure, should we look at it more like a life-saving measure in knowing that the data suggests that this is the best way to keep them alive?
Okay.
Should we let the minor have a say in their life-saving treatment? And that's the issue here. I think a lot of people suggest that this is it's a just for fun gender procedure. That's not what this is. In adulthood, you can do that as an adult. Most of the time it's not, but you theoretically can. But for a minor, that is not at all the case. Like, you have to meet enough criteria to where your distress with your gender incongruence is interfering with your life so much that doing these interventions would be way better for you, even if there are risks involved. And that's the same thing with all medical care. That's the same thing with all of it. There's risk with blood transfusion. There's risk with vaccines even. But there's and so do the risks outweigh the benefits? And that's the situation.
So 2 questions, and these I want to be very clear about this. I am not citing these statistics as facts. These are just information I've been given. So I've heard 2 things from conservatives that object to this. One is that the trans suicide rate is abnormally high due to mental illness. And the other one is that people who transition, 49% of them regret it and go back on their transition. Is that bullshit?
That regret rate you gave me is absolute bullshit.
Okay.
The regret rate is closer, like at best, like at the highest, to about 2%.
Oh wow. Okay.
So it's really low. And if you think about it, regret rates for knee surgeries are a lot higher than that. One of my favorite examples to give is pregnancy. Regret rates for pregnancy are way higher than that, especially emergency C-sections have granted that's an emergency, but emergency C-sections have a regret rate of over 60%.
Really?
Like regular pregnancies have a regret rate probably around like 7 to 10%. So like people regret a lot of things, and you're allowed to regret things. People regret cancer surgeries, like some
Really?
procedures, like, well, I mean, particularly like robot assisted prostatectomies. Any kind of prostatectomy is a brutal procedure.
Is that removing the prostate? Is that a
Yeah.
prostate? Okay.
Yeah, and so it's brutal because you're interfering with their ability to pee. You're interfering with their sexual function. Like people really regret that, and so you have people that would rather have cancer than have had that surgery.
Really?
And
It's that bad?
is that bad? Yeah, there's some things that are like really terrible to go through. There are a lot of people like CPR. There are lots of people that did not want to have CPR done to them, and they're like, just let me die next time. Like there's so many things that we do that have regret rates. The problem is the public doesn't understand those because the public doesn't care about them. The public isn't in the conversation with people about their surgery experiences and what, like, no one cares about my neighbor's ACL surgery, whatever. That's because it's not as hot button of a topic, but everything has a regret rate, and transition has a significantly lower risk of detransition than most other procedures. And like that's saying a lot when people are saying that, like, shouldn't we shouldn't do this because so many people regret it. Oh, are we going to stop doing these other things? No, we're not. We're going to keep doing them. So is it a risk? Yes, it is. But that's why you have to have conversations between the healthcare provider and the patient and say, this is what could happen to you. Are you okay with that? And they consent to it. And if the doctor's not clearly communicating, that's a problem on their end, but that's not a problem with the entirety of the medical practice.
Right.
So it's one thing to, I wish that like nobody regretted anything, but that's not realistic. And somebody is going to have complications. But I do want to clarify too that a lot of times when people detransition, it's not because they're not trans. It's because they are treated so badly that they feel like they have no other choice.
Oh, that's terrible.
And so you have to take that into account too, that regret rate isn't purely a regret rate from people who are not trans that thought they were trans. It's also trans people who just want to exist in a world that doesn't hate them, and they have to pick a way to go.
Okay.
Along the
it's
and this is why gender affirming care is so important, because these interventions like puberty blockade and HRT and like starting things earlier can prevent a lot of that from happening. Because if you don't develop all of your male characteristics, it is a lot easier to live as a woman. I'm not saying it's easy at all, but
I'm going to get another sip of my water, but if you can expand on that.
Well, yeah, but just because people reflexively refer to people by gender pronouns, they have we still have gender roles, unfortunately. We're not going to be able to get rid of them. I don't think ever, but there's some sense of your gender in society, and people treat you differently based on that. And if people, and we actually, it's funny because we see a lot of this though with cis people, where there's cis women who have developed some more masculine characteristics that will be accused of being trans, and then they will get harassed, or they'll get assaulted. And we've seen a lot of this in the media too, where people are transvestigating, trying to see who's trans because of their finger length or their head size or whatever. And like, characteristics exist on a spectrum. And unfortunately, the way that we've learned to engage with society is to gender other people and to make assumptions about your gender.
Okay.
And so when it's a lot easier, it's often easier for somebody who was assigned female to put on some more masculine clothes, and oftentimes they might be accused of being like a 13-year-old, but it's easier for them to kind of blend into society based on the gender stereotypes that we commonly associate.
Okay.
However, if you have more male characteristics, you're less likely to fit some of those stereotypes, and people who care about those stereotypes are often the ones that are going to be violent towards you. And so we see a disproportionately high number of trans women that are victims of violence due to the way they present.
Now, is it a correct statement that Black trans women are the most oppressed of any other group?
It would sound correct. I don't have statistics in front of me, but they have an intersection that is disproportionately affected by a lot of these issues.
Okay. All right. I want to get into some
and
questions. Oh, sorry. Go
yeah,
ahead.
and I didn't get to hit on your mental illness question.
Yeah. Please touch base on that,
yeah.
because I've heard several say, now, I have not read the DSM-5, but to my knowledge, there's no anything in the DSM-5 that refers to trans being a mental illness. However,
Yep.
I've had a lot of conservative friends object and say being trans is indeed identified as a mental illness. What do you have to say about that?
It is incorrect, because when you think of mental illness, you are thinking about distress. Because, I mean, think about it this way. A lot of people can have like anxiety. Like, you've had moments of anxiousness. You've had moments of anxiety. I think everybody has had moments of anxiety, but not everybody like has an anxiety disorder. There's a point where mental illness does negatively impact your life based on what is going on like in your mind. Like, it's the anxiety that is giving you distress and dysfunction. Depression, it's what is going on. Like, it's not as much the external world. The external world can impact that and make it worse. But if you have something like OCD, if you have something like anxiety, oftentimes affirming those things makes you feel worse about it. It makes the condition worse. The same thing with body dysmorphia. There's a distinct difference between body dysmorphia and gender dysphoria. And so a big difference is the distress coming from external factors versus stress coming from internal factors, and the degree of like your perception of the situation. So body dysmorphia is a disorder of perception of yourself. And so you have a skewed view of who you are and what you look like, which is why if you, let's say you have dysmorphia about your muscle size, like a lot of men, like both cis and trans men have this. They're like, I'm not buff enough. I need to go back to the gym. Like, I'm too fat. I need to work out more. And they can get up to a super, super jacked set of muscles, but still feel like they're not doing enough.
Right.
It's not the fact that they're out of shape that's giving them that distress. It's that they don't see themselves appropriately, and that's what gives them the distress. You try to fix the distress, and it just makes it worse because you're not fixing your perception.
Okay.
This is different. This is completely different to gender dysphoria because there isn't a flaw in your perception. Trans people know that they're trans. They know what their bodies are. And their body is giving them an external form of distress.
Okay.
That when you address it, when you affirm them, it gets better. It goes away. So currently, I don't have gender dysphoria. Like,
Okay.
I've had, like, my ability to go about my life, my ability to, like, exist in a society and have them treat me the way that I want to be treated. Like, granted, I have not had certain surgeries, but I'm at a point where, like, with the things that I've done, like, I don't have that distress anymore. There are times where it may come up, where, like, if someone misgendered me, yeah, I'd feel that again. But those issues largely go away. And so I think a lot of people will suggest that that gender incongruence or gender dysphoria is not seeing yourself as you are. But I think most of us would disagree and say, no, the distress is because you see the reality, and the reality is not the reality that fits you in the world that you want to react with.
Okay.
Right. Like, if I don't like when people say that, like, you're born in the wrong body. Like, that's a way that people have overly simplified it.
I've said that before because that's actually, and correct me wrong, that's an argument I've used against people who are against trans stuff. I've always said, like, it's like they're being born in the wrong body. So please correct me and expand on that.
Yeah, it's an oversimplification, and for some people it can be helpful. But it's, if you think of, and this is maybe getting into some more of our secular content and, like, how we kind of logically think through things. But we know that your consciousness is an emergent property of your brain, right? So the person that you are is because of the physiological processes in your brain that all come together and produce you as a person. The difference is the stuff that's going on in your brain to make you does not align with what your body is trying to do to make you. And so a lot of people would say that the things that make you are in your brain and not in your physical body. Like, I heard an argument very recently that was excellent. Go back to the concept of, if you put your brain, like, if you took out your brain and put somebody else's brain in your body, would you still be you? Like, even if it was alive, would that be you? And I think most people would say no. So the core of who you are, your sense of self, is somewhere in this combination of what your brain is doing, what your chemicals in your brain are doing, all that. We don't know a lot about how that process contributes to gender. We're still kind of working through it. But what we can get to is that your brain produces yourself, and that self has a gender identity for the most part. Some people would say that they don't. But that sees the external, like, physical body that you have and says, that's not what you should be doing.
Mm-hmm.
Like, that's not the process you should be going down.
Okay.
And so it's just the process your body is doing differs from the process that your brain is doing. And it's very convoluted, but I hope that kind of
it does
makes a little bit more sense.
Yes. So let me ask you this. And I actually had a conversation, I'm not going to name names, with someone close to me last night because we're on different sides of the spectrum. So I wanted to know if they had any questions. And he said he has an issue with being identified as a cisgender male. And he said, why do they get the right to identify me and not as a male, but as a cisgender male? How would you handle that?
Yeah, I would talk to him and I would say, so do I not have the right to call you a brown-haired male? Do I not have the right to call you a tall male, a short male, whatever, 30-something-year-old, 40-something-year-old? Like, you have characteristics about you that are adjectives. Cis is an adjective that would describe a man or a woman, and trans is also an adjective that would describe
Okay.
somebody. So it's equivalent to giving an adjective, and so it's not erasing your being a man or being a woman. It's just you are a subset. You are this subset of a woman, because there's so many different types of women. Like, I'm sure if everybody pictured in their brains a woman, some people might think of someone with brown hair. Some might think of somebody with blonde hair. Some people might think of a thin person. You might think of a tall person, a short person, like an older woman, a younger woman. Like, there's so many different people that we all wouldn't conjure up the same image if you just said woman. That's the same thing. We're just adding another descriptor. And a lot of times the people that are offended by the use of cis, they get angry, I suspect, because they use trans as a slur. And if they see trans as a slur, then cis must also be a slur. And so it's not the word, it's they're suggesting that, the flip side is a bad thing. So this word must be a bad thing for me.
Okay. So we have a bunch of questions we got to get to, but
Yeah.
at this point, we're not going to have enough time to get to all of them. So
And I've answered
hope,
a lot of them kind of in what I've already said. So
yeah, I just hope that we can actually do a part 2 to this. But before
for
we
sure.
dive into the questions in the live chat, there's a topic I want to dive into, which is a big topic and will probably take some time to discuss. But it's trans in sports. And let me give an example. I am a biological male. I identify as a male. Now, if tomorrow I decided to compete in the UFC and say I was a trans woman, for instance, fighting my girlfriend, is that fair? Because from my understanding, I have higher bone density, I have more testosterone, I have better fast twitch. What is it called?
Well,
Twitch.
here's the thing. You wouldn't be able to just go in and say you're trans and then go out. Most sports have a set criteria you have to meet before you go compete.
Really? I didn't know that.
Yep. It's usually you have to be on hormones for about a year to 2 years. Somewhere in that spectrum is where they'll kind of cut off. The data suggesting that by a year, you are pretty much at the same like athletic capability, so to speak, as your cis counterparts. In the study from 2021, which was done, it's in one of the British journals of sports medicine, but it was done on U.S. Air Force airmen doing their physical fitness test. And the trans women, after a year, everything had normalized to the level of their cis counterparts, except they had maybe 12 to 15% residually better like endurance.
Okay.
Like for running. But trans men had, after the year of testosterone, pretty much everything had evened out. And when you think about sports, there aren't just like one or two things that make for a good athlete, right? And make for a competitive athlete. So every sport's got different things that they rely on. Like strength isn't always like strength as in like super bulky lifting all the weights. Like people think that's athleticism, but running doesn't really favor that kind of body type in certain ways. Agility is something that matters, and your muscle mass, higher muscle mass, can impact your agility and make you less agile. Also, there's some less flexibility in cis men. So like there's not only advantages, there's also disadvantages to whatever body type you have. And people forget that. Like what makes a good athlete isn't just one dimensional. Sure, you've got strength, but you've also, like, in certain combat sports, you have like arm's length matters, height matters, weight matters, agility, like I said, strategy, timing, training, all of these things go into it. And to say that one sex by default is better than the other one all the time is incredibly disingenuous and fallacious as an argument, because nobody's the same, for one. But people aren't as different as we think. A lot of things that tend to make men better than women in athletic activities are size related. Because there are people, there's cis women with incredible muscle mass.
Of course.
There are cis men with very minimal muscle mass, like super scrawny guys. And it's like, you can't just assume everybody is equal in sports. Secondly, sports are not inherently meant to be biologically fair. I want to demand that the NBA open a short person's league, because it's not fair that I can't compete with the 7-foot tall people. That's kind of silly. Like, you can't say, like, would you go to like, if you see some of the videos of volleyball players, there is like an international match between a Scandinavian women's team and a Japanese women's team, and there's a substantial height difference, but they're all in the same league and they all play the same game. So there's inherently biological advantages and disadvantages that people just have, but people aren't complaining about, oh, this girl's too tall, this guy's too, especially for men. They don't complain at all for men, like, this man's too tall, this man's too beefy, unless they're testing for steroids. But yeah, it's like, for men, you want all the biological advantage. You want to be the biggest guy there. But for women, it's seen as not womanly. It's a lot of the regulation and a lot of the sentiment behind trans women in sports relates to the need for women to be inferior and the assumption that women are inferior, which is very, very interesting to me. But
Can
something I like to,
1 second?
Yeah, go for it.
So, what are your thoughts? And I apologize, I didn't mean to interrupt, but this is on topic. Do you remember that trans woman that got really good at swimming and ended up beating everyone else in that Olympic swimming? And the right-wing conservative movement started freaking out because apparently she didn't perform well in the man's division. Like,
Well, no, and it wasn't Olympic. This was college.
Oh, okay, my bad. I thought it was.
Well,
Olympic.
no, but a lot of these trans people, it's funny because the media will blow up when a trans person wins, but nobody's watching all the times that these trans people lose, and they lose a lot, like, in their women's categories. But people stuff that down because that doesn't fit their argument. Like, trans people have been able to compete in the Olympics for a long time, and only just recently did we have trans people actually qualify for the Olympics as trans women and compete. The most recent example of somebody, the one I'm thinking of, I know Stephanie is probably out there thinking of all the other examples that I'm missing, but this trans woman who is in weightlifting, who qualified and then lost right away. Nobody's freaking out about they freaked out before she lost, but then she lost and now people don't care anymore. So right. It's like they only care when trans people do well. But the thing is, the goal is to do well. They're in sports.
Right.
But to say that their win is always going to be like cheating and they're not ever allowed to win, should we get mad at cis people for winning? Like, it all goes into the same pot. Like, these people aren't really that different from each other. And like I said, like, most of the sports organizations have their own criteria that you have to meet in order to compete in those gender divisions. And if you're meeting those criteria and you're hormonally the same, like as your cis counterparts, and you're largely performing very similarly to them, like, that shouldn't you shouldn't have the spotlight on you every time you win just because you're trans. Like, have the spotlight because you won. But something I like to think about is jujitsu, because that's where I come from.
Same.
But
I love jujitsu.
yeah, so follow me on this example. You know how in a lot of tournaments, if you don't have enough people in your weight bracket, they'll bump you up to the next weight bracket.
Correct.
And so you've got these tiny people. It's usually the smaller people moving up to the bigger weight classes. So is it more fair for, let's say you have a cis woman and she's like 135 pounds, something like that, or even like, yeah, I'll keep it there. So like 135 pounds or so, and then you have nobody in her division. Is it more fair for her to fight up to 160? Like, because sometimes you go up multiple weight divisions. Is it more fair to fight someone who's 160 and your same sex, or to fight a man who's also 135 pounds? Like, think about the size of 135-pound man. Like,
That's
they're
pretty
small.
small.
They're small.
Yeah, that's a tiny guy.
But they're out there. And it's like, the fact that he's a man doesn't make him this gargantuan dude.
Right.
He still meets the criteria to be in that weight class. And like, I pretty much exclusively did jujitsu when before I transitioned. So I competed women's, and like most of the people that I trained with were the smaller guys, because like you fight pretty much the same. Like, you have very similar styles, you have very similar like, there might be a tiny bit of muscle mass difference, but at that point, jujitsu, like, doesn't matter that much. If your technique is better than theirs, you're going to win.
Well, absolutely. I
The
agree
thing
with
that's going to get you is like, the weight does matter. Your weight absolutely matters and makes it harder. And I would much rather have fought somebody my weight who is a guy than to fight up and fight somebody who is 140, 150, 160. That's a huge weight difference. And so, and so it's just like, people need to think about like how much of the heavy lifting are you making the gender component take in your thought about sports? Because is it a contribution? Yes. It's less of a contribution than people are granting it. And you need to think about the rest of the variables in the equation is where I'd go with that.
Yeah, I understand where you're coming from, because I used to do competitive strongman, and I was always the smallest guy. Even when I was at the peak of my strength, I maxed out at 195 pounds. And when I was competing, the lowest division I could compete in was 200 to 235. Now, granted, I still did great, but I get what you're saying. Like, there was no other weight class I can compete in. So we get a bunch of questions, and we're not going to get to all of them. So I think we're going to have to do a part 2 if you're okay with this.
Yeah, I'm okay with part 2.
I'm not going to get to the questions I emailed you. I want to get to the live questions that we've had through the people that are watching. So we could save, if you're up for it, we could save the other questions for another stream.
Sure.
So the first question I have is from Ameet Mathew. Question from Dr. Ben. I've heard that different sexes have different symptoms for things like cardiac incidents. Do those symptoms align for trans people with their gender?
There's more study being done on this, but from what I've seen so far, I actually did like a good deep dive on cardiovascular disease and transition, like during my intern year. And yeah, the majority of data we have on trans people shows that they will present in similar ways to their cis counterparts. So yeah, and that's something too that I mean, and you'll have people of like all genders, all sexes, like falling on different parts of that like pain spectrum and where they perceive pain and how their symptoms present. And I think what it's opened up for us in the medical field too is it's shown that you can't rely on somebody's sex or gender to determine what symptoms align with their like condition. You kind of have to use your brain a bit more, like we should be doing, and not just
Right.
make assumptions, but actually do your job. So, but yeah, the data does suggest that.
Okay. Next question comes from Puck, who has been a part. So he's one of the first people. I don't know if I've ever said this on screen, but he's one of the first people that ever reached out to me once I started my YouTube channel. And he was like, in the most polite way possible, he was like, "Hey, I saw your debate. Do you need some help with that?" And I was like, "Yeah, I need a lot of help because I'm not good at debating. I don't have the knowledge other people have." But he was the reason one of my channel started taking off a little bit, because he got me a couple of YouTubers, well-known YouTubers on my channel. So Puck's a good dude. But to Dr. Ben, what is the recommended amount of therapy and or social transition recommended before medical intervention is considered? Are these cases where the answer should be zero? Do you want me to
Yeah,
put it on the
it
screen?
depends. Yeah, it depends on the individual. You can't really standardize how much therapy or how much social transition, because every scenario is different. You have to work with the patient on, like, if they've, like, for some people it's more obvious if they've thought about things since they were like a toddler and they've like always known, or if they've kind of been telling their parents like since a young age, and now they're like, it's been 10 plus years. Like, that's a super obvious case of like, okay, maybe we've done enough work on this to be where we need to go. For some people, if they decided, like, I think I might be trans, and they decided yesterday and they're not sure, it might take them a little bit longer to kind of feel comfortable that, this is the right move for them. But really, you can't standardize a timeline like that. The only way we're really able to standardize a timeline or like suggest guidelines for a timeline is for developmental age. And that's because it's the one thing that's going to be the most consistent, depending on, like, to kind of generalize to the whole group, is that, hey, you shouldn't really start HRT until you're in adolescence, um, and that kind of thing. So it's not as much of a, you have to be doing this for a certain amount of time. I think that needs to be a case by case basis.
Okay, cool. All right. Next question comes from Cynthia McDonald. She's actually the person that does all my thumbnails for YouTube. So thank you, Cynthia. Are there any side effects taking puberty blockers as an adolescent?
Yes. There's always risk with anything. And so kind of the big thing that people point out is like bone density issues, which is like a much less prevalent issue than people often make it out to be. Especially if you are going to be going on some kind of hormone therapy, or if you're going to be undergoing your endogenous puberty. So if you're on puberty blockade for a really long time, obviously you're not undergoing pubertal growth. You're not getting your growth plates fusing. You're not having like your bones grow like they need to, and so you can have some bone density issues if you're on that. And really, the guidelines are suggesting that, like, past 2 years, you kind of have to be a bit more cautious with something like that. But the actual safety is probably longer, but we're on the conservative side, just, because this is the data that we have and this is what we can generalize. That being said, for most people, you're going to be adding HRT on top of it, or you're going to be taking off the blocker and going through your own puberty, which should counteract the majority of any bone density issues that you would have. Of course, I can't say with 100% certainty that 100% of people are going to have no complications, because that's dishonest. I can't say that.
Right.
There's always a risk that some people may have lingering bone density issues, but that's something that you talk with people about when they're going to be starting. One of the other big things is like fertility concerns. We we believe with the data that we have from minors with precocious puberty, etc., people that have
Sorry, what type of puberty?
precocious puberty, like the one that we
What does
talked
that
about
mean?
earlier, where
Okay.
it's early puberty.
Okay. All right. Got it.
So for the most part, people get back their full sexual function once they stop the puberty blockers. There is some risk though that you will have be a bit behind in that development. And so there could be a question of fertility and what exactly that would do to your fertility. We know that with starting cross-sex hormone therapy, there's a very high risk of infertility. So like starting estrogen, testosterone, and that's something we talk in depth with people about of like, hey, this could impact your ability to have children and like most likely will affect it. But the puberty blocker will be much, much less so than HRT would.
Okay.
And so, yeah, and so even for some of the risks that you're getting with the blockers, it's less of a risk than if you just started hormone therapy right away.
Okay. Cool.
So,
All right. Next question we got from Cindy PLAZA. For those that know Cindy, she appeared on my channel a few times. She
mhm,
heard me call. So originally, what kind of kicked me off is I called in to talk heathen because I had a friend who was trans and their family wasn't accepting of it. So
mhm.
they had asked me to talk to their family about it. So I called in to talk heathen and I asked the hosts on the channel for advice. And Cindy, being trans, heard my call and she reached out to me and spent over the several weeks constant hours educating me on trans stuff. So
That's amazing.
here, yeah, Cindy's a great person. I'll be interviewing her in a couple weeks. We will be talking about euthanasia. Okay, so question from Cindy. Uh, Sapolsky uses gender dysmorphism in the brain as an explanation for trans identity. Do you agree? And did you read the studies he's quoting?
I don't know the answer to that. My stuff that kind of goes more into psychology is not really my area. Um, from what I know, we don't really know a lot about what causes um, someone to have gender incongruence. There's a possibility that there's a structural difference or like a neurotransmitter difference or hormonal difference, like in utero, or receptor difference. I don't know. And it might be a different answer for different people. There might not just be one answer. I've not read that person's papers, but the most honest answer I can say is I don't know, and I don't know if a lot of people like there isn't a consensus on it for sure.
Okay.
So
So follow-up statement. I got a few more questions, but follow-up statement from Cindy. Sometimes early puberty is a consequence of sex abuse. What are your thoughts on that?
um I there's I'm sure there's a possibility that you could have a change in like brain signaling from that, but again, that goes more into psychology and I'm not a psychologist. But even if that is the case, that would not be the only cause because I mean, really precocious puberty is puberty that starts early. And with as many factors that play into puberty, um, it could be any number of those variables that could cause it. So I don't have a super good answer on that one either.
Okay. Got a couple more questions. This next one is from Puck. Meta question. Since people who are knowledgeable about any deep topic will always be outnumbered by people who are not knowledgeable, what's the best system for enacting meaningful legislation? I put in case you need to reread it, I put the question on the screen.
Yeah. I have a lot of thoughts on this. It's very annoying for me that like so medicine is already regulated by their own like medical boards. Like each state has their own medical board run by physicians, and they have specialty boards that regulate their own specialties of like what the guidelines are, what the appropriate use of treatments are, all of that stuff. And then we have our like government that thinks they have any right to step in and be like, actually, you can't do your guidelines because I said so, as if they have any knowledge at all. I don't think it should be left up to like the government, like to make those decisions. I think medical practice should be overseen by like medical boards. And like in terms of like the crossover, you kind of get into some weird places with funding. Like, how do we fund it? Because of course the government does make decisions about funding and insurance and all that stuff. And so that's where it can kind of get sticky. But at the end of the day, it should be up to the medical boards to regulate medicine, and the government should grant the power to the medical boards to be able to regulate that, because they don't understand the nuance involved in a lot of the decisions. So the issue is way more complicated than I can even get into. And
Okay.
In this, and I know we're
Okay. So I have two last questions. One's from the audience and one's from me. Or actually, I should say this is just a statement. Dr. Ben reminds me of Neil deGrasse Tyson on how well he teaches. I hope you go into academia eventually.
Well, that's sweet. I might eventually, if I burn out from clinical medicine. That is a possibility, but.
And then my last question. Now, we still have that. I sent you an entire Word document of questions to get through. We haven't even touched on any of those. So I won't ask you on the air. I'll save this for our private conversation, but I would love to do a part 2 to this because we haven't even scratched the surface, I feel.
Yeah, absolutely.
But how do we determine, if it even matters, the difference between someone who is trans and the difference between someone who just wants to be trans?
I don't think it really matters all that much. Because as long as they're not hurting anybody, they're not, because like the arguments that people are just claiming to be trans to go use the women's bathroom is absurd, because we don't have bathroom monitors. You can literally just walk into whatever bathroom you want. And it would be way less work for you to just walk in there and assault somebody, if that's what you wanted to do, than to go tell a doctor you're going to do like transition, go to a therapist, get hormones, get surgery, all that. Like, people who want to do bad things for the sake of doing bad things are like, they're just going to do it.
Right.
The people who put all of that time and effort and like and all of the violence I mentioned that happens to trans people, like transitioning and even coming out as trans is not a benign process. Like, you are acknowledging that your life is going to probably suck a lot. And like, that is your everyday life. Like, it's not something you like put on and take off. Like, you are trans all the time. Like, and people that have the courage to exist openly as trans people, like, just want to live their lives. They just want to do that. And right. I think if someone's doing bad things, punish them for the bad things. Don't punish them for existing. Like, if someone's assaulting somebody in the bathroom, punish them for assaulting somebody in the bathroom. Don't punish them for being in the bathroom. So that's kind of my thought on that point.
Okay. Okay, so we have another question from Titan Uranus. They wanted to, and I hope I'm asking this question correctly. They wanted to ask about puberty blockers after puberty starts and if it has a negative effect. I believe we touched base on it, but I don't think
Yeah.
they were here for that answer. So, what would you say to that?
Yeah, there are some side effects always, like always potential. You can go back and watch that part of the question if you want. I
Okay,
don't want to
and
go in the whole thing again.
that's fine. And to answer Ember's question, what
Yeah.
does want to be trans mean? I can't even wrap my brain around it. So this is not a question from me. I'm using objections I've heard from my family, from some friends who are very conservative, right-leaning, on what they think of this. To give you an example, I sent out a message to my entire family, and I said, "Look, my entire family is right-wing conservative." I sent a message to them. I said, "Look, I never promote my podcast to you, uh, but this is one I'd love to hear some feedback on. Do you have any questions?" And one of the questions that arose was, how do they tell the difference between someone that is trans and want to be trans? And what I mean by that is, what if someone, instead of being trans, says, "Hey, I just want to be a man," or "Hey, I just want to be a woman." So that is
Yeah.
what, I hope that answers your question, but that is what they asked. Okay, so I really hope we can do a part two to this because we didn't get to any of
Yeah.
my email questions, but I would like to ask you this. What do you got going on? What streams do you have coming up?
Yeah.
Anything exciting going on?
Well, I'm not doing as much right now. I had a pretty busy like stream weekend. But you can still find me on the Transatlantic Call-In show. I don't know when my next appearance on there will be, but I'm usually there every couple weeks or so. You can find me over on Talk Heathen. Was just there this past Sunday, so probably won't be back on for a little bit because I was just on. And then I mean, I've got my YouTube channel. I'm trying to get back into. It's been the holidays, so I haven't been doing as much. But hoping to get back into medical myths, and then also doing some trivia or Jackbox over on Twitch on Friday nights.
Have you done, and I feel like you have you done an episode on circumcision yet?
I haven't done like a full episode, but it's definitely one that is I'm planning on doing at some point.
So I would love that. And while I can't comment on it from a doctor's perspective or an intellectual perspective, I wish I was never circumcised. And fortunately, my mom has, like, she sees my status as she came out and, like, argued with a few people and said, "You know what? I regret having my children circumcised." And I regret it too, because to me,
That's another procedure that's more regretted than transition. Like, hey,
yeah,
that's
dude, I
another
regret it
example.
so
Yeah.
much. I wish it wouldn't have happened to me because I am way less, and I'm sorry, fair warning, TMI, sexual content coming, but I have way less feeling than most of the men I know. It takes me, and this is, I don't even know if I should be talking about this. This is probably TMI, but at least I'm warning everyone beforehand. I have an incredible difficult time orgasming. I can't orgasm with a condom on, and only very few women in my life have ever been able to make me orgasm. I wish I was never circumcised. I hate circumcision. I will rally against it any day of the week. I think it is barbaric. I think it is horrible, and I don't think circumcision should even be legal. How do you
Yeah.
feel about that, Dr. Ben?
I think it should be illegal, but not as routine infant. I think adults should be able to get it when they can
Oh,
make their own
sorry. I
decision.
should
But yeah.
clarify. Oh, sorry, you were talking. I apologize.
Oh no, you're good. But yeah, I think it's one of those things that, if you're an adult and want to make your own decision, you should be allowed to. But you should not be like doing that to babies.
So,
So
because from my understanding, one, The doctors that perform circumcisions are usually inexperienced, don't have training, and are just new to the hospital. And two, from my understanding, and please, Dr. Ben, correct me if I'm wrong, but that it can actually cause permanent psychological damage because of how intense the pain is. Is that
Yeah.
accurate, or is that not correct?
I mean, I've done 4 circumcisions and I hated every minute of it. Um, I have some nuanced thoughts about the issue. I wouldn't say that most people that are doing them are inexperienced. I think there are a lot of very experienced people that are doing them. The people that are less experienced are like, you have to do so many supervised before you can do them on your own. But yeah, I could see it causing some long-term damage because I mean it is a painful procedure. Like we didn't let parents in the room while we were doing it because you can't
Just the thought of it. Oh,
yeah,
I'm holding
no, you
myself
can't
right
control the
now.
pain enough. Um,
Right.
so yeah, I don't think it should be done on babies.
Yeah, me neither. Okay, so was there anything else we missed that you want to touch base on? Otherwise, I'd love to save the rest for a part two of this interview because we haven't even scratched the surface, I feel.
Yeah, I don't really have anything else. I think the big things I've already touched on to some extent throughout the stream. So I think we're good, but I'd be happy to do another one at some point for sure.
Awesome. All right. Well, thank you, Dr. Ben. Stay on hold for a second so I can do our outro and talk to you after the show. Thank you, everyone, for watching. I hope all's going well. I am getting back into all my streaming. I have several shows. I have three or four shows lined up, one of which is the pickup line, which I'm sorry to report it will be the last episode of the pickup line ever with Hannah Vaughn. But I'm going to continue. Hopefully, I will have my new headphones and studio set up by the end of next week. Thank you to all my patrons, especially Cindy Plaza, who has been a patron of me since and hounded me to get. She is literally the reason I got a Patreon account. So thank you, Cindy Plaza, for being so supportive. Dr. Ben, thank you so much. Hang on the line and we'll do our outro.